Okay, so now we're going to talk about active immunizations. See, it's sideways. I don't know. I was feeling writing it sideways. So first we're going to talk about the 4 different categories of active immunizations. You have active and passive, as well as artificial and natural. So artificial, active. This is, you go get a flu shot, you get the flu shot antigen. So you're getting an immunization. If you just get sick, like you go to school and you catch the flu from somebody, you're getting natural active. So you get sick, you get the illness, you develop antibodies to the illness. Natural passive, this is from mom to baby, so either through the breast milk or through the placenta. So it's naturally happening, but the baby's getting it passively, just through the mama, just like they're getting chips and salsa if the mama's eating chips and salsa. Artificial passive, this is where you're getting the direct antibodies into your body, antibodies into your system, I guess, if you want to say it like that. So you're being administered the actual immunoglobulin. For active immunizations, you do not give these to patients who are immunocompromised because you're giving them something active. You don't want to create an active infection in somebody that's got a decreased immune system already. So just remember that. So those are the 4 different things. You need to remember this, especially for the test. The teachers could say, what is an example of something that is active natural or passive artificial? Just remember, active natural is where you get the patient's getting sick and they develop the antibodies on their own. Active artificial is where they're rolling up into CVS saying, hey, give me that flu shot. I don't want to get sick. Passive natural is from mama to baby. So breast milk, placenta, those are the 2 ways. And then passive artificial is where you're getting the immunoglobulins administered to your body. So there you go. You need to know that. Now we're going to talk about the active immunizations that we talked about in class. So we're going to start here and then go down. Tdap, Tdap, or TD. This is for diphtheria, tetanus, and pertussis, which is whooping cough. And you'll see underneath each one, so Tdap, D-tap, Tdap, TD. God, I can't say this stuff, but you'll see them. This one you can administer to patients 6 weeks to 6 years old. This one is typically patients who are over 7 years old. So if they're not here, they get it here. And this one, they are going to need a booster shot. And then this TD is the booster shot that patients can receive every year. So I got my tetanus shot I got this shot when I was little. And then when I was like, I don't know, 8 or 9 or something, I don't know, I was cleaning a window on a service project day and I hit my finger on the wood window and I got a splinter up underneath my fingernail and it hurt so bad and it bled and it was gross and all that stuff. But since it was an old window and it was a place that we were trying to clean anyway, my parents took me to go get a tetanus booster shot. So TD is the booster shot, just to make sure I wouldn't get tetanus. So that's what people say. This is what people mean when they say, oh, I need to get a booster shot. I stepped on a rusty nail or whatever. This is that right there. So Tdap is for 6 weeks to 6 years. Tdap is for people who are over 7 and they are going to need a booster shot. And then TD is the booster shot that people would get every 10 years. Hib is for Haemophilus influenza type B. I'll just zoom in on that so you can see that. And typically people who need to receive this vaccine are those at-risk groups. So people who work with people who have this. So typically it could be like healthcare workers or maybe prison workers or just people in that line of field that work with people who have this. Hep B, this is also given to people who are at risk. So healthcare workers, prison workers. Hep B, that vaccine is contraindicated in people who have a yeast allergy. So whenever there's something that says contraindicated, that's just something you need to remember that it's oh, this one's contraindicated in people who have yeast. This one down here is contraindicated in people who have an egg allergy or whatever. So that's what we're going to talk about. Next category over here is the flu vaccine. Everybody can get the flu vaccine. Everybody should get the flu vaccine. It is contraindicated in patients who have an egg allergy. So if you have an egg allergy, sorry, dude, you could get the flu. That would suck. MMR is for measles, mumps, and rubella, and this one is contraindicated in people who have an egg allergy as well, and patients who are pregnant. Pneumococcal, I hope I say that right. I think I said that right. This is for pneumonia. You can give this to people who are smokers, patients who are over 65, and children who have chronic illness. There is something to note that if your patient is over 65, they would get Prevnar 13, while patients, I think it's 19 to 64. I think it's like, it's not Prevnar, but it's like, let me see. I'm going to look it up for us. Pneumovax. Pneumovax 23 is what patients 19 to 64 get. If they're over 65, they get Prevnar 13. It's just a different thing. It takes care of 13 different strands. So, I mean, it's just something different. But people all ages 18 and up can get this, but actually everybody can get this. I don't know why I said that. If it's 19 to 65, they get Pneumovax 23. If it's over 65, they get Prevnar 13. And I'm guessing there's some special little strand that children with chronic illnesses receive. Contraindicated in patients who have acute febrile illness and those who are in an immunocompromised state. So remember we talked about up here, people who are immunocompromised cannot get active immunizations. Just something to remember. The next category is polio virus. There's two different ways that patients can receive this, whether it's an injection or orally. Like back in I think it was the 50s, people would go, when they would go to Africa on like medical mission trips, they would give children in Africa little sugar cubes with OPV on it, which is the oral live virus for polio, to help them develop the antibodies for it. This way is for like mass outbreaks, to help prevent mass outbreaks in third world countries. And IPV is an injection. That's the inactivated virus. So polio, there's two different forms. OPV, it's not typically used anymore, and IPV. IPV is not live, it's inactivated, and it's an injection. And then OPV was the live virus, which was oral, and typically it's like a little drop of the juice on a sugar cube. Next category is for rabies. This is typically given two different ways, either after a bite has occurred or before a bite for people who are really prone to getting bites. So after bite is going to be post-exposure, obviously, and then before the bite is prophylactically. So people who are prone to get bitten by possibly rabid animals, so like vets or animal workers or animal control workers, these people would be getting it prophylactically. Gardasil is for the human papillomavirus. HPV can lead to cancer because of the genital warts that are created from HPV, but Gardasil stops that stuff. It is contraindicated in patients who have a yeast allergy. I believe this was the drug that there's now like a campaign, or there's an ad campaign that's like, Mom, did you know that you could stop my cancer when I was at age 11? Because they're really pushing parents to give children at age 11, 12 Gardasil before they get sexually active to prevent HPV and then eventually cancer from forming. Such a sunny topic. Okay, Zostavax or Shingrix. This is for herpes zoster, which is like for shingles. And Shingrix specifically can prevent neuropathy. So that pain, that nerve pain with a patient who has shingles, this drug can help prevent that. It is contraindicated in patients who are immunocompromised, who are pregnant, who have a neomycin allergy or a gelatin allergy. And then the last drug we have here is Varivax. This is for varicella, which is chickenpox. And it's contraindicated with the use of salicylates because it can increase the risk of Ray's syndrome. So those are the different active immunizations. Remember, if you see something is contraindicated, that means that people who have like that egg allergy, or if they're pregnant, or if they have a yeast allergy, they cannot have that particular immunization. Yeah, there we go.